My favorite quote from Grey's Anatomy that is spoken by Meredith Grey, she says, "On average, our hearts beat 70 times per minute. In the same 60-second period, we blink between 10 and 15 times, swallow once, and take up to 20 breaths. Our hearts beat, our lungs breathe, and our bodies keep us alive, but most of us barely notice. We just take it all for granted." Today, I will be talking to you about the evolution of pediatric heart surgery. I believe I can tell you this topic and this speech with great detail, as last year I did my History Day project on the pioneering of open heart surgery, and I want to be a surgeon. I don't know what kind yet, and yes, cardiothoracic surgery is one of my options, but I still do not know for sure. And my points broken down into that I will be talking to you about today are the first few successful pediatric heart surgeries today, and future heart surgeries. So starting with basically the first few pediatric heart surgeries that were done. The first one was done on November 29th in 1944, and that was called Ballock-Towsing solution. And the disease was called tetralogy of Fallot, and that was where it mostly tended to happen in infants and babies, and their skin would be blue because they would not get enough oxygen, and most of them would not live because they wouldn't have enough oxygen. And this solution is how surgeons would help and try and get them to turn pink like a normal color so they would have oxygen. Okay, so his solution was to increase oxygen levels by creating a connection between the oxygen-rich level and the oxygen-deprived blood vessels. And this surgery and solution was performed by Dr. Alfred Ballock. The second one that's helped improve heart surgery was Dr. Robert E. Gross, and he was from Boston and worked at the Boston Hospital. And his success was he ligated the patient's arterial duct in 1938, and that helped to show that heart surgery can be a future use and be a future accomplishment and in saving many lives. Now that I have talked about past and the first pediatric heart surgery, I will now talk about heart surgery today and the types of heart surgeries that doctors and surgeons can perform. Heart surgery has evolved immensely, whether they have created better techniques or found better tools to use, and the better understanding of physiology in our bodies has helped overall with better outcomes. Heart surgery today can treat defects in infants and children that are fairly minor to minimally invasive with a heart-lung machine, and they can also use non-surgical treatment. Operations today can repair or replace heart valves which control the blood, and they can replace abnormal or damaged structures. They can help with heart donation, where you are in heart failure and you need a new heart, basically. And the way they do that today is with a person who is brain dead, so their brain won't function and so their body won't function, but they're on like a ventilator, so they're still alive, but they won't be able to function in the world. So, and those people that have signed and said that they want to be donors are the people that can donate their organs. And that heart surgery today can also treat coronary heart disease. Now that I've talked about heart surgery today, I will now move on and talk about the heart surgery that can happen in the possible future. Surgeons and doctors are talking about creating 3D holographic visualizations that can be touched, marked, and manipulated during heart surgery. That can help the doctors to see better, to see inside of the patient better, and to know more of what they're doing, and also make the imaging bigger. There's another 3D way for heart surgery in the future would be to bioprint engineer cells to grow into a heart valve, which can replace a heart transplant. And that would be very helpful, as you don't have to, you can just grow one instead of waiting for someone who is a donor that is brain dead, or who is your match, or whatever, like your blood type. And yeah, so hopefully they can figure that out soon, because that, I believe, will save many lives. Today, I hope you learned lots of new facts on pediatric heart surgery, being the first few pediatric heart surgeries, and heart surgery today, and possibly heart surgery in the future. Heart surgery has grown tremendously over the years since the 1900s, as there have been new machines, new tools, and new information about our bodies, and which techniques are better to use, and which ones have better possible outcomes. Relating back to my favorite quote on how our hearts beat, our lungs breathe, and our bodies keep us alive, I hope that you will take that into consideration and think about how grateful you are that your body is working and your heart keeps pumping every day, and that your body's just keeping you alive. Thanks for listening.